Hi, so my name's Henry. I'm one of the senior hand therapists, and we're looking today to try and help you regain movement and function in your hand following a fracture to one of the long bones or metacarpals in your hand. Now, these exercises are designed to help you following this injury, and these exercises are going to be the same whether you've had a fixation, so an operation, maybe some plates or screws put in the hand or wires to fix the fracture, or whether your fracture's just in a reasonable position and it's being managed without any surgery. So the idea is to try and get the hand moving, maintain all the soft tissue lengths, and try and reduce any stiffness and any pain that you will experience following this type of injury. And now let's do the exercises together. So the first exercise we're looking to do is mainly based on trying to get these big knuckles in your hand moving. Okay, so nice and simply, you want to keep your wrist back, keep that in a good position, and you're looking to try and just bend the hand from the big joints, so you're only bending these big knuckles on your hand, trying to keep the smaller joints in your fingers nice and straight, bringing the hand back up again, and just trying to repeat that 10 times. The things to look out for: if your hand's a bit stiff, your wrist might want to wander forwards, or if these joints are a little bit stiff, you may just start to try and curl the small joints down. But really try and keep the fingers in tight together and just bend from the big joints up and down 10 repetitions. Nice and gentle, you're not trying to force it too much, and just repeat that nice and comfortably. Okay? Now the second exercise, we're going to reverse this, so we're going to keep the big joints nice and still, and you're going to move the smaller joints in the fingers down. So you're hooking the fingers over, as if you're hanging onto a windowsill. Okay, so fingers straightening up, and then curling the fingers down. And again, watch what your wrist does, because the tendency is to let your wrist bend forwards, so you're keeping big joints nice and straight, straightening up the small joints, and then hooking them back down again. And just repeating that 10 times, and again, nice and gentle. You're not trying to force anything, you don't want to do too much, you're just trying to make sure that all the small joints are moving nice and freely. Okay? And once we've warmed up with 10 of each of those, you're then going to try and combine the two movements together. So again, thinking about wrist position, keep it in a nice, relaxed position, and you're going to try and bend down from the big joints, and as those big joints come down, you're then going to curl the rest of the fingers in, just into the palm, gentle squeeze, and again, you're not looking to squeeze too hard, you're not looking to go for a really forceful movement, it's just a gentle movement, big joints down, curl the small joints in, straighten back up, and again, nice and relaxed, thinking about wrist position, and you're just going to do 10 repetitions of that one. Okay, so just one more time, 10 repetitions bending the big joints, up and down, 10 repetitions hooking the fingers over, and then 10 repetitions where you combine the two, big joints in, gentle squeeze. Okay, and you want to try and repeat these exercises each hour, so come out of your splint, do the exercise routine, and then put your splint back on again. So when you're doing your exercises, there's always going to be an element of pain because you have a broken bone. Now, you want to try and manage that pain, so it's worthwhile speaking to a pharmacist or a GP about painkillers or anti-inflammatories, things that will help to reduce some of the discomfort and allow you to do your exercises a bit more freely. However, if you are getting an increased level of pain and that pain doesn't seem to be settling down, then it's always worthwhile contacting the therapy department or speaking to your GP for further advice.